Good afternoon, ma'am. I'm Marco Inalbis, and for today, I will be having my return demonstration on the care for the umbilical cord aseptically. So, ginagawa po natin yung procedure po na ito para pumiwasan po yung cord infections. Pero during the pregnancy po, yung mother, binibigyan po siya ng anti-tetano vaccine po para pumiwasan po yung tetanus po sa baby po. So, we are going to prepare the materials needed. We are going to prefer the surgical gloves or the sterile gloves, then the sterile scissor, the cord clamp, and the cotton, and a betadine solution or with alcohol with 70% solution. And we also be needing diapers for the aftercare of the baby. And as well as a round circular basin. Dito po natin lalagay yung mga salt dressings po na nagamit po natin while doing the procedure. So now, we are going to perform proper hand washing. After hand washing, we will be putting on our gloves. So I have a sterile gloves here, so I'm going to open the package. Make sure not to contaminate it. Then you're going to drop it on the sterile field. And open it. Then I'm going to put on my gloves on my right hand first. Then insert 2 fingers on the sterile field of the gloves. Then I will be putting on the gloves on my left hand rather. Then adjust the grip or the cuff. Make sure not to contaminate it. Then discard the packaging. Some hospital institution wait until the umbilical cord stop pulsating. So now we are going to inspect the umbilical cord for the presence of the blood vessels. So we should compose of 2 arteries and 1 vein. Okay, it is good. It composed of 2 arteries and 1 vein. So we're going to disinfect the umbilical cord with betadine or alcohol solution. So it should be circular motion from the navel outward. So we are going to discard the used cotton ball on the circular basin. So now we are going to clamp the umbilical cord 1 inch from the navel. So we have to make sure that it is properly secured to prevent any bleeding. So put the second clamp 2" after the first clamp na nilagay po natin kanina. Yung kailangan, hindi po siya mahihila or matatag at the umbilical cord para po maiwasan po yung bleeding. And after that, we're going to cut the cord just above the clamp. And make sure to protect the abdomen of the newborn. So yung blade po dapat away from the baby abdomen. So we're going to cut. So now we're going to disinfect once again the umbilical cord using a betadine or alcohol solution and a cotton ball. So the strokes must be inner to outer. Then we're going to discard the used cotton ball and the circular basin. Then after that, we're going to discard the excess cord into the container and other used sold materials. So after that, we have to make sure that the umbilical cord is not covered with any dressings. The stump gradually dries and shivels until it falls off. It usually takes for about 1 to 2 weeks after birth. Along with other newborn assessment, we have to check every 30 minutes to 1 hour for at least 6 hours the umbilical cord for any bleeding po. So after that, we're going to put on clean clothes and diaper. So pagkatapos po natin mabihisan yung baby, we're going to remove our gloves. Then we're going to dispose it in a proper trash bin. And after that, we're going to perform proper hand hygiene, or we are going to wash our hands. Then we're going to observe for the signs of bleeding and infections. Thank you po.